Welcome back to my channel. Today we're going to be discussing IBS. This might be something that you've heard of. Maybe it's something that you think that you might already have. Or maybe it's something that your GP has said that you might have as well. Well, IBS stands for irritable bowel syndrome. But what does that actually mean? Well, there's a lot of different definitions out there, but the official diagnosis is known as a change in bowel habits associated with abdominal pain that lasts for at least 6 months. So how does that translate into symptoms? So symptoms of IBS can really vary and they can be individual person to person. That means that you may have some symptoms and another person has completely different ones, but they can both still be IBS. So some of those symptoms include diarrhea, constipation, or maybe even both. That would mean maybe some days you've got constipation, other days maybe you've got diarrhea. Other symptoms include bloating, increasing wind or flatulence, stomach pain, and that stomach pain can sometimes be associated with needing to run to the toilet and open your bowels. These symptoms can come on suddenly. They may be caused by food and drink. They could last for days, they could last for weeks. They could happen weeks apart, months apart. And IBS can be diagnosed in different ways. So how is IBS diagnosed? Well, you typically go see a doctor who would run a few tests. These tests might include a blood test. Within this blood test, they may test for something called celiac disease. Now, celiac disease is related to the gluten in foods and is an autoimmune condition, which means that it can be genetic. Once they confirm that is negative, they may want to also run a stool sample test. That would involve providing a stool sample to your doctors and they test it for things like inflammatory bowel disease. If those tests are negative, normally you might be referred to a dietitian to go through a food diary and a symptom diary to look at if there's any relationship between the foods you're eating and the symptoms you're experiencing. And we'll go through that more in my next video. So how can IBS be treated? Well, diet is definitely one of the biggest treatments, but you also have lifestyle changes, mental health, exercise, a low FODMAP diet, medications, and yoga and breathing exercises. Now, the dietary advice and the other treatments vary depending on your symptoms, whether you've seen a healthcare professional before, whether you've tried any diets already. So there are some trigger foods such as lactose, high-fat foods, caffeine, which can basically trigger some symptoms in certain individuals. So you'd work with a dietitian ideally in completing a food and symptom diary and trying to figure out what some of those trigger foods could be for you. In our next episode, we will discuss more about these trigger foods, why they're trigger foods, and what you can do to improve your diet and hopefully improve your symptoms. See you soon!